Welcome to the Psychology Club podcast, brought to you by Vicente Martinez High School.
One.
Welcome to the Psychology Club podcast. I'm your host, Evie. Today we are interviewing Danny from A3. Welcome, Danny.
Thank you.
I'll start the first question off. What is A3?
Thank you so much for having me. And like Evie said, my name is Danny. I work as a community support worker with A3 Crisis Response. And what is A3? So A3 stands for Anyone, Anywhere, at Any Time. And we are a mobile crisis response team, which means that we go out into the community when someone's having a mental health crisis or a substance use crisis or a combination of the two. And we assess and evaluate folks for an involuntary hold, as well as de-escalate crises, connect them to mental health resources, and safety plan with them as well.
Thank you.
Hi, my name's Elizabeth. So how did A3 start?
Hi, Elizabeth. So A3 started right after Miles Hall, who was tragically killed by law enforcement in Contra Costa County. That was in June of 2019. And he was a young Black male who was experiencing a mental health crisis. And he was shot and killed by police. After that, his mom, Ton Hall, really went in to advocate for her son's, death, and really wanted to have like a innovative way of how Contra Costa responds to mental health crises. So in January of 2020 is when the A3 initiative started. So that was a combination of police, fire, emergency medical services, a couple mayors, just people in the community really rallying behind a new way to respond to behavioral health crises in Contra Costa. And A3 has really been in effect for the last almost 2 years in March of this coming year. So after the A3 initiative in 2020, it really took off in March of 2022.
Hey Danny, my name is JD.
Hi, JD.
What inspired you to work at A3?
So what inspired me to work for A3? I was actually, a little backstory about me. I am in recovery for drugs and alcohol, almost going on 4 years now, and I'm also a mental health consumer. So that means I've navigated the mental health system in Contra Costa before, and I was actually receiving services at the time that this Spirit program was presented to me. And Spirit is a 6-month, 9-unit college course that certifies you to be a peer support specialist. And I take my lived experience from being in recovery from drugs and alcohol, as well as being a mental health consumer, to go out in the community and help those that are still maybe having their crises. A3 ended up doing a presentation at my Spirit while I was going to school for Spirit, and I just knew that was the program that I wanted to work for. So after I graduated, I was able to get a job with them a month later, and I'm just so happy to be with the program because it's something that I'm super passionate about, and I just really feel like I can help the community in that way.
Okay. I'm Elizabeth, and how does the country support your work, your organization does?
Hi, Elizabeth. So we are a county-ran program. So essentially what that means is that we get all of our funding through the county, but we also get funding through Measure X dollars, which is just like a 1-cent tax that people have I think when they're like purchasing items within the county. And so we are able to get funding through that. But all of what we do is essentially like government ran. So we do have certain limitations, but for the most part, we're all here for the community. We serve all of Contra Costa. I hope that answered your question.
Yeah.
Hi, I'm Brianna.
Hi, Brianna.
And where are you guys located?
So this is actually a really good question. We are at an undisclosed location. This is for our safety purposes. So we do not have any clients that come and visit us where we're located in the county. We are strictly a mobile response team. So that is why we don't tell anybody about our location. And also kind of going back to like the county ran things. All behavioral health clinics in the county have a deputy on site, and we do not have that. So just again, for safety purposes, we have an undisclosed location.
Thank you. How do people connect to your services?
Great question. So they can call directly. Our phone number is 844-844-5544. And within seconds, you'll be able to speak to a live agent, someone such as myself. We also have like a multidisciplinary team, which means we have several different types of people that work at A3. Some of them being clinicians, which are like therapists, mental health specialists, community support workers, which is what I do. We also have substance use counselors and level 1 interventionists. So as long as they call that 844 number, then they can get a hold of us. If they do call 911, they can also request A3 through that.
So what is the most common mental health call you guys get?
So the most common mental health call that we get, I would say, is probably suicidal ideations. We also get a lot of calls of folks experiencing psychosis, which means that they might be hearing voices that are not their own. And that can be really scary for someone that is experiencing that. So I would say those two are the most common call, someone that's in psychosis or someone that's experiencing suicidal ideations.
Do you guys get more calls at night or day?
I would say we get more calls during the day. I feel like you would think that they might be at night, but we actually get more calls during the day. That's the busiest time for us, is like 8 a.m. to 5 p.m.
What are tools and methods you use for certain calls and situations?
So a certain tool that I have, and really which is in something that's like in my wheelhouse in every facet of my life, but my lived experience is really what I bring to the table. That's really the purpose of my job. Is if I go out with a therapist, they kind of have that clinical background, so they have that book smart of what's going on, and I come with the lived experience of saying, hey, like I have had, thoughts of wanting to end my life as well, and this is how I navigated through that. So really gaining that like trust and rapport with the individual is really most important.
And then how do you guys de-escalate challenging calls?
So I've definitely been on a lot of challenging calls, and we have this idea of having to stay in like a triangular formation with the client, myself, and my partner, but always making sure that I'm in the line of sight of my partner. So if JD and I went out, we would kind of create this triangular formation, kind of like if you think about soccer a little bit. And that way we still have eyes on each other, we still have eyes on the client, and we're all having a safe distance from one another. The other thing is that we always keep ourselves at a level tone. Don't show any outward emotion, even though I might be freaking out on the inside. On the outside, I'm cool, calm, collected. And then that brings everybody kind of down to my level.
How does your job affect your mental health?
So my job is definitely challenging a lot of the time. I'm really, really blessed to have a good support system, and our bosses, managers tell us that you need to take care of yourself. So self-care is number one for us. And so I have time with my family that is a really good support system for me. I live with my parents while I'm going to school, and they're a really good support system for me. I also have a big support system through my community. I'm a member of AA, so I go to meetings when things get challenging. I talk to my sponsor, I talk to my sponsees, and just having that sense of community that's outside of what I do really enables me to leave work at work. And then when I get home, I can think about my home life, and the two usually don't mesh.
What is the most effective way to help someone?
I think the most effective way to help someone is just to listen to them. A lot of our clients that we go and see in the community don't feel seen and heard in their life, and they really just want someone to be there with them, to not think that they're quote unquote crazy, and really just like validate their experience and validate their emotions that are coming up for them. So I feel like listening is a huge part of what I do.
All right. Have you ever had a mentally challenging call, and how did you cope with that?
So I can think of a couple mentally challenging calls that I've been on, and those calls definitely stuck with me for a long time. And it's just something that, you might go out on a call and that triggers a memory for you, or an experience that I've had. And, I just empathize with our clients so much. And so usually when that happens, like I said, my coping skill is to go to a meeting. And so I will talk to my sponsor about it. I'll reach out to my other support system, like my parents, my friends, and just say, hey, this was challenging for me today. I think a huge part of leaving work at work is having accountability for my feelings and my actions. So for me, telling people and talking to people about it, I've had that experience where I stuff things in, and I just know that that's not healthy for me. So I always like to be able to talk about it. So
Thank you.
And then, is there anything else that you wanted to say?
yes, thank you so much. So a couple things that I wanted to mention. One is that we are 24/7. So that means you can call day or night, and someone will pick up the phone. There's someone to respond. So that's really cool. We did 24/7 coming up on a year now on December 1st. And then another thing that I wanted to mention that Elizabeth brought up, thank you, was that we take any insurance. So it doesn't matter what insurance you have, which is Kaiser, John Muir, Medi-Cal. We take all insurance, so coming out to you is free of charge, and calling us is free of charge. So, yeah. Thank you.
Thank you.
Thank you, guys.
Thank you, Danny, for being our guest and telling us about A3. Thank you, everyone, for watching. Make sure to like and subscribe for more great mental health from our psychology club.